Mesothelioma is a rare but aggressive form of cancer that primarily affects the mesothelium, which is a thin layer of tissue that covers many of our internal organs. The mesothelium is vital in providing a protective lining for organs like the lungs, heart, and abdominal organs, allowing them to move smoothly. Mesothelioma arises when cells within this lining begin to grow uncontrollably, usually due to asbestos exposure. Mesothelioma is relatively rare compared to other forms of cancer. In the United States, about 3,000 new cases are diagnosed each year. Countries with a history of heavy industrial use of asbestos, such as the United Kingdom, Australia, and parts of Europe, have seen higher rates of mesothelioma. In recent years, the dangers of asbestos have become widely recognized, and its use has been restricted or banned in many countries. Types of mesothelioma. Mesothelioma comes in several types, primarily depending on which part of the body is affected. Number 1. Pleural mesothelioma. This is the most common type, affecting the pleura, which is the lining of the lungs and chest wall. Since the lungs are frequently the organs exposed to airborne asbestos fibers, pleural mesothelioma accounts for approximately 75% of all cases. It often causes breathing difficulties and chest pain because the lungs are impacted. Number 2. Peritoneal mesothelioma. This type develops in the peritoneum, which is the lining of the abdominal cavity. It is much less common than pleural mesothelioma, but can cause severe abdominal pain, swelling, and digestive issues. Number 3. Pericardial mesothelioma. This is an even rarer form that affects the lining of the heart, called the pericardium. This type is extremely difficult to diagnose and treat due to its location near the heart. Number 4. Testicular mesothelioma. This is the rarest form, affecting the lining surrounding the testicles. This form is so uncommon that there is limited research available, but it is generally associated with localized symptoms in the testicular area. Causes of mesothelioma. The primary cause of mesothelioma is exposure to asbestos. Asbestos is a naturally occurring mineral that was widely used in construction, shipbuilding, and various industries due to its heat-resistant properties. When asbestos fibers are inhaled or ingested, they can become lodged in the mesothelium. Over time, these fibers cause inflammation and genetic damage to the cells, potentially leading to the development of mesothelioma. Asbestos exposure doesn't just happen in high-risk occupations like construction or mining. People living or working near asbestos-containing materials can also be at risk, as well as family members of workers who may have brought asbestos fibers home on their clothing. The link between asbestos and mesothelioma was first established in the 1960s, but the use of asbestos continued in many countries for decades afterward. Even today, asbestos remains present in many older buildings and products. This persistence means that people can still be exposed to asbestos, even in countries where its use has been banned. One of the most insidious aspects of mesothelioma is its long latency period. This means that it can take anywhere from 20 to 50 years after asbestos exposure for mesothelioma to develop. This long delay between exposure and disease onset makes it challenging to pinpoint the exact cause in some cases and complicates efforts to prevent the disease. While asbestos exposure is the primary cause, other factors may contribute to the development of mesothelioma. Exposure to erionite, which is a mineral similar to asbestos, has been linked to mesothelioma in some regions. There's also evidence suggesting that genetic factors may play a role in susceptibility to the disease. Some studies have indicated that radiation exposure and certain viruses might increase the risk of mesothelioma, but these links are less clear and require further research. Symptoms of mesothelioma. The symptoms of mesothelioma can be vague and easily mistaken for those of other, less serious conditions, especially in the early stages. For pleural mesothelioma, the most common symptoms include chest pain, persistent cough, and shortness of breath. Patients often describe a feeling of tightness or pressure in the chest. As the disease progresses, they may experience difficulty swallowing, hoarseness, and swelling in the face or arms. For those with peritoneal mesothelioma, symptoms tend to be focused on the abdomen. So it typically presents with abdominal pain and swelling, changes in bowel habits, and unexplained weight loss. Patients might feel a mass in their abdomen or experience nausea and loss of appetite. As for pericardial mesothelioma, which affects the lining of the heart, it may cause symptoms like chest pain, difficulty breathing, heart palpitations, and fluid around the heart. Given its proximity to the heart, this form of mesothelioma can lead to severe complications early in its progression. For the rarest form, testicular mesothelioma, symptoms usually involve a mass or swelling in the testicles, often without significant pain, although discomfort may arise as the condition progresses. Across all types of mesothelioma, fatigue and unexplained weight loss are common symptoms. As the disease advances, patients may experience more severe pain, increasing difficulty breathing, and a general decline in health and well-being. Diagnosis of mesothelioma. The journey to diagnosis typically begins when a patient presents with symptoms and a history of potential asbestos exposure. However, given the long latency period of the disease, many patients may not recall or be aware of their exposure. The diagnostic process usually starts with imaging studies. Chest X-rays can show abnormalities in the lungs or pleura, but they're not specific enough to diagnose mesothelioma. CT scans can provide more detailed images and can reveal the presence of tumors or fluid buildup. For suspected peritoneal mesothelioma, abdominal CT scans are used. PET scans, which can show areas of high metabolic activity characteristic of cancer, are sometimes also used to help determine the extent of the disease. While imaging can suggest the presence of mesothelioma, a definitive diagnosis requires a biopsy. This involves taking a sample of the suspicious tissue for examination under a microscope. There are several ways to perform a biopsy, depending on the location of the suspected tumor. For pleural mesothelioma, a thoracoscopy might be used, a procedure where a small camera and instruments are inserted through small incisions in the chest wall. For peritoneal mesothelioma, laparoscopy, a similar procedure performed in the abdomen may be employed. Once a tissue sample is obtained, pathologists examine it to determine if mesothelioma is present, and if so, what type. Blood tests may also be part of the diagnostic process, as certain proteins and markers like mesothelin and fibulin 3 may be elevated in people with mesothelioma. However, blood tests alone cannot diagnose the condition. Treatment for mesothelioma. Since most mesothelioma cases are diagnosed in later stages, treatment is often focused on managing symptoms and prolonging life rather than curing the disease. Surgery is one option, particularly for those diagnosed in the early stages. In pleural mesothelioma, which affects the lungs, a surgery called pleurectomy with decortication can remove part of the lining, and sometimes the affected lung, to relieve symptoms and slow the progression. Another surgery called extrapleural pneumonectomy involves the removal of the lung, the lining, diaphragm, and pericardium, but is a more aggressive approach with higher risks. For peritoneal mesothelioma, a surgery called cytoreductive surgery can remove as much of the cancerous tissue as possible from the abdomen. This is often combined with a treatment known as heated intraperitoneal chemotherapy, where heated chemotherapy drugs are applied directly into the abdomen during surgery to kill any remaining cancer cells. Chemotherapy is another common treatment for mesothelioma and may be used before surgery to shrink tumors or after surgery to destroy remaining cancer cells. The most common chemotherapy drugs for mesothelioma are a combination of pemetrexed and cisplatin, which have been shown to improve survival rates in some patients. Radiation therapy is another treatment option, often used in conjunction with surgery and chemotherapy. It involves using high-energy beams to kill cancer cells. In mesothelioma treatment, radiation is often used after surgery to kill any remaining cancer cells or to alleviate symptoms in advanced cases. Despite these treatment options, mesothelioma remains a difficult cancer to treat effectively. Many patients receive palliative care alongside their cancer treatments. Palliative care focuses on managing symptoms and improving quality of life, rather than curing the disease. This might include procedures to drain fluid from around the lungs or abdomen, pain management techniques, and support for emotional and psychological well-being. Now we want to hear from you. Do you or someone you know have experience with mesothelioma or asbestos exposure? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.